It's been a tumultuous year for people who work in the mental health care system and for the families of loved ones who are patients. Jobs, funding, and facilities have become a major issue as our state transitions from the current model to a community-based one. Horace Allen is here from the Community Mental Health Task Force of West Alabama to tell me more about it. Horace, thanks so much for being with us today.
I'm glad to be here.
Yes, sir. You guys are in the business of trying to make sure that everyone's on the same page and they understand what's going on, right?
That's correct.
Tell us what you have planned.
Well, the Mental Health Task Force, in an effort to clarify some of these issues that have arisen in the news, is having a conference on October 11 at the University Church of Christ, and that is going to focus on the future of mental health in Alabama. We'll have some special guests there, Jim Reddick, who's the Commissioner of Mental Health, and Timothy Stone, who is the Medical Director for the Department of Mental Health. And then there will be local officials who will be there as well. So we're hoping to have a nice turnout for that. Hardy McCullum, the probate judge, and Ted Sexton will be there also, along with the Assistant Chief of Police. And the whole idea is just to give people a sense of and give them an understanding, really, of where we're going, and to allay some anxieties that people may have had about the changes. And we've seen things in the paper that suggested one kind of change at Bryce, and then that was reversed and changed. So the whole purpose of this is to clarify that and just help people understand better.
There seems to have been so much, like you said, back and forth on what was going to happen at, like, say, a facility like Bryce. Other facilities around the state have closed. And
That's right.
there has, and I hate to sound like an alarmist, but people would say things, and you would see things on the internet like, well, what are we going to do with these people? They're going to be out roaming the streets and this, that, and the other. Isn't that dangerous? But that's not the case, is it?
No, it's really not. The current medications and the mental health, the community mental health system itself is geared up to be able to help support and handle people that require some assistance. Mm-hmm. But medications nowadays have done some amazing things. And the Community Mental Health Center system, people don't realize this, but for a number of years now, it's handled over 100,000 patients who've been supported in the community for many years. And there will be more now that will be taken care of in the community as well.
All right. And definitely, you don't necessarily have to work in the mental health field or be any kind of expert. This conference is for people who have questions.
It is for people who have questions. Professionals, counselors, nurses, social workers can get continuing education credits for participation. But really, we're after anyone in the community who has any concerns. And they'll be able to register at the conference between 8:15 and 9 o'clock. Conference begins at 9. And I believe you have a graphic.
We do. I'll read it to the folks in just a minute.
That will tell them how to do it online or by telephone as well.
All right, super. Horace, thank you so much for being with us.
It's my pleasure.
We'll put that graphic up there he mentioned. The Free Mental Health Conference is Thursday, October 11th at University Church of Christ. Registration starts at 8:15 a.m. or you can register online at cmhtf.org or by calling 205-972-5582.